Hey everyone, welcome back to our channel, Dr. B and Mary. Today we are going to talk about Prion disease. And you might have never heard of this. This is super rare, but we're going to talk a little bit about it, what it is, and what it's also known as.
So Prion diseases, as Mary said, are very rare neurological diseases. They cause neurodegenerative disease. And prions are proteins that are folded abnormally and can induce that abnormal change in the proteins that are next to them. And so they spread rapidly throughout the brain. The most common type of prion disease that we would see is Creutzfeldt-Jakob disease. We'll spell that out for you. It's, again, the most common type of a prion disease that we'll see in this country. There are variants. There's a called variant CJD, and that was seen in England a number of years ago, associated, we think, with abnormal contaminated beef. But in this country, this happens in about 1 per million per year. So 1 person in a million every year, or plus or minus, will develop this. So in Austin and Round Rock and whatnot, there might be 1 case in the region every year. So again, it's very rare, and it unfortunately is rapidly progressive. From symptom onset until when someone passes away, it's about 9 months or so, give or take a little bit. So it really does progress pretty rapidly. Patients with CJD will often not only develop cognitive symptoms, but walking or gait symptoms and abnormal movements. We call these myoclonic jerks. So the muscles may sort of randomly twitch like that. And there are some changes that we see on testing, but those are what we call the clinical symptoms.
And are those symptoms something that you notice early on? So when someone comes to you, are those symptoms that you're noticing immediately whenever they're in your office?
Yeah, but they vary. The cognitive symptoms will progress for sure, but the physical, the twitching, the myoclonus, the gait changes, usually they happen within the first few months or so, but it really is highly variable. When someone comes to the office, we will do our history, our physical, look for abnormal movements, check memory and whatnot, and often get a brain MRI. Brain MRI is sometimes diagnostic for this condition. And it's not always that clear from the brain MRI, but sometimes it is. And so we might not need to do a spinal tap, or maybe not more than a couple of blood tests if we see these characteristic changes on the brain MRI. Since it's, again, a progressive disease, there's not a cure for it, not a treatment other than help with symptoms of depression, agitation, and whatnot. And then, as with many neurodegenerative diseases, it's important to support the family. So provide care, counseling for the family, because it is difficult, obviously, for them.
So we're creating these videos to talk about some of those common types that you'll see and then less common. So we kind of cover a little bit of everything on their channel.
Right. Again, this is on the very rare side of things. But yeah, we're happy to be here.
Yeah.
And it's a chilly day here in Austin. Mary's got your ski attire.
Yes.
So there's some slopes down behind us. Maybe you'll hop onto next. But thanks for coming, and we look forward to seeing you next time.
And as always, if you did like this video, make sure you click that like button and subscribe to our channel.